Myself and my counterpart at the Royal Liverpool Hospital, Mr. Danny Brown, have been involved in reconfiguring services for a number of years now. We've even discussed it as trainees. The idea is basically to put specific patients with specific needs in the right place to have their operations and care. So currently we have two hospitals, the Royal Liverpool and Aintree University hospitals, doing very similar things about 5 miles apart. And the idea of collaborating between the two departments is that we can put bigger numbers of patients into each hospital. So we can do all our trauma patients in the hospital at Aintree. So we get increased expertise from both a surgeon's point of view and the teams in theatre and the wards, so that everybody gets used to dealing with trauma patients, and there is good evidence that that means that patients' outcomes get better. The same is absolutely true for planned surgery such as hip or knee replacements. So we would like to move all patients for planned operations, for example a hip replacement, to Broad Green Hospital. That again means we're doing more volumes of patients there. The surgeons and the staff in theatres and the wards are getting better and better as they do more of the same surgery. And there is again good evidence from the elective, the planned point of view, that this gives patients much better outcomes and decreases complications. It will still be the same surgeons doing both the trauma surgery and the planned surgery, but we'll be doing it in two sites where we can specialise out more and have our staff more specialist in the particular areas that they're practicing in. So from my surgeon's point of view, I'll be coming over here to do the trauma surgery and help out on the emergency on-call rota, and we will also have some surgeons who just specialise totally in trauma surgery. For my elective, for me it would be hip and knee replacements, for example. I would then go over to Broad Green Hospital where I could join the team that did them regularly and did increased volumes of those sort of procedures. So from a surgeon's point of view, we'd just be moving sites so we could treat patients in a more specialised environment. Currently we have to provide emergency care at both hospitals. Now if we're able to move the majority of the emergency care to one hospital, which in the plan will be Aintree, we'll be able to put our resources and staff into that one hospital and improve the quality of patient care. I think the main thing is because the surgeons and the teams are doing more of the same procedure, there is very good evidence both for trauma and for the planned surgery that patients do better. They recover better, their outcomes are better, they are less likely to have complications. Patients may need to travel a little bit more for their planned surgery, but when we've looked into this, it may only be a couple of miles more for maybe 30 to 40% of the population. For the trauma surgery, actually the major trauma, the really injured people already come to Aintree hospitals, and we've already started super specialising here at Aintree. So we wouldn't expect much difference from the trauma surgery. It may mean that occasionally someone who has an accident where they've broken something and needs an operation, they may need to travel over to Aintree to have that operation, but we will still be doing the clinics, which is 90–95% of our broken bones work at both the Royal and Aintree hospitals.